Welcome back. Traditionally, psychotherapy has focused on dealing with people's problems, but what about their strengths? Today we talk to Dr. Tayyab Rashid, a therapist and researcher who focuses on strength-based resilience, an approach that helps people improve their lives by focusing on their strengths. Dr. Rashid is an associate faculty member at University of Toronto's Scarborough campus, where he conducts research, counsels students, and trains mental health workers. Welcome to the show, Dr. Rashid.
Thank you.
So, Dr. Rashid, you do a lot of things at the University of Toronto Scarborough campus. You do training of mental health professionals, and also you lead a research team as well. Can you tell me a little bit about some of the different activities you're engaged in?
So I'm a licensed clinical psychologist at University of Toronto Scarborough, and primarily I do about 3 days of clinical work, working with students, giving them, offering them psychotherapy, individual and group, and some consultation. In addition to that, I also do clinical research, and my research focuses on resilience and well-being. And in that domain, currently I'm working with the high school students as well as outpatient clinic. And then I also do some training for mental health professionals.
Okay. And what do you enjoy most? Is it the clinical practice, the training, research?
I think I enjoy clinical practice most because the research that I do is informed by my clinical practice, and my research is exploring is the clinical practice working or not, or how can we tweak it, how can we refine it, and then my training and teaching is about that.
Okay, and can you tell us about how you got interested in this? And I know your research is in strength-based resilience. How did that topic and that field catch your interest?
So the strength-based resilience program I started when I was working at Toronto District School Board about 7 or 8 years ago. And the way I came to know start the program was back in 1999. I was my first year of doctoral studies in America. And I lost both of my parents in 18 days. I'm originally was born and raised in Pakistan, and went back, came and resumed my studies, but with grief also came depression. And I did a lot of remedies to lift myself out of depression. But I think my biggest antidepressant illness was this issue of positive psychology, January 2000. One of my mentors left in my mailbox, and I read it cover to cover in one weekend. And from that point onwards, it became very clear to me that as a clinical psychologist, my job is not only just to remediate problems. My job is also to explore what is good in people, where is their resilience, and how we can bring that out in scientifically valid ways.
I've heard you mention in one of your talks that psychotherapy has, for the longest time, focused entirely on people's problems, whether it be their anxiety or phobias or trauma, but you feel that's not enough. Why do you think it's important to, turn the tables and focus on people's strengths?
I think psychotherapy has made a good start. Just to begin with, focusing on problems is important. Problems are real, and they need real solutions.
And I guess people come with their problems.
People come with their problems. So if you don't listen to and address their problems, you are of no good. Where I think positive psychology and the concept of resilience comes in is that we in the Western world have focused on psychotherapy and mental health profession for the longest time on what is wrong with people, what is wrong with patients, with clients, on their disorders, dysfunctions, deficits. So it's for the longest time it has been a deficit-based model of healing. You can get pretty good in reducing the symptoms or in managing the symptoms. Sometimes you can't reduce them. Sometimes you you equip clients with the strategies to manage them well. But think of this simple analogy. You can bring the client from -8 to -2 by working on the symptoms. But is this what the goal of psychotherapy is or should be? I do not think so. And when I was studying with my mentor, Dr. Seligman, Martin Seligman at University of Pennsylvania, this is actually his analogy. He talks about psychology not only reducing from -8 to -2, but also coming to neutral and then helping people, facilitating the process of growth to -2, -4, but +2, +4 in the positive territory. Is always a linear progression? No. We are complex human beings. Sometimes we dip back. But I think the most important notion in mental health for me in the last 15 years is that human beings are not only a composite of problems, deficits. Where they bring their grudges, we, the mental health professionals, should also explore the gratitude. When they talk about being criticized, perhaps gently we can nudge and bring their attention towards when they were complimented. We all remember the failures, the tragedies very well. Can we also sometimes focus on the triumphs, even though they may be small, but in an authentic, in a genuine way? It's putting both the positive and negative of our existence together. I think that is much more exciting, also very challenging.
I want to ask you about that challenge in your clinical practice. Is it easy to get somebody to shift their perspective from the negative to the positive, or does a client or the patient feel that, well, I want to dwell on the negative and I need time to deal with that?
It's I never rush. For me, the most important psychotherapy inherently is and should always be an interpersonal process. So it's a process where two human beings in a very secure space discuss uncomfortable aspects of their lives with the trust, with empathy. So that foundation, that cushion of psychotherapy cannot be tarnished, cannot be taken away. And in order to build that trust, I first need to attend to the problems, if that my client talks about. But I think my job as a clinician is not only to listen to problems, my job, and empathize, which I do. My job is also to bring them towards what are the bright spots in their lives. Is it easy? No.
When we talk about positive psychology, sometimes it gets a bad rap. It sort of feels like an empty, feel-good, airy-fairy type of thing. You know, think some good thoughts and go out there, maybe do some exercise and you'll feel great. But you've tried to add a lot of content to the field in order to make it something more substantial and meaningful. Can you explain to us what really you mean when you talk about positive psychology and strength-based resilience?
Like any new field, and especially any field which will have the two words, psychology and positive, it will attract attention of people, and with lots of people will come and they will interpret and practice it in their own ways. It's very difficult, honestly. It's very hard to control for any organization. But I think so the criticism is valid, that it sounds like smiley face, happiness and happyology. And some folks do give the impression by their practice and research. But the field has grown and matured sufficiently in last 10 years that we now know that if you experience positive emotions in a genuine way, they not only open your cognitive, your thinking channels to problem solve in a better way, but they also are responsible for your immunity. So people who experience more positive emotion in a genuine way, they have, on a cellular level, research shows they have better immunity. People who experience positive emotions, they are more likely to associate with others and be more helpful. So I think those kind of studies are coming up, and they will then sort of demystify this thing that positive psychology is happyology. There's hardcore science data is coming up, because the field is still new relatively to 100 years of 100 plus years of Freudian psychology. It's a nascent field, and it will take time, but I'm optimistic that in an ideal world, Elias, in about 50 years, you don't need a positive psychology, because the psychology should be psychology which gives equal attention to positive and negative.
So we've just scratched the surface here, and before we need to take a break, maybe you can give a practical example of, when you talk about strengths and strength-based resilience, what are maybe one or two of the strengths that are examples that you try to get your patients to identify with?
So one of my, all the strengths have different values and different, they are valuable in different contexts. But one of the strengths I think is kind of a master strength for me is the strength of gratitude. So gratitude is not simply saying thank you. It's an enduring sense of thankfulness, but thankfulness expressed in action. So I would suggest to our audience that it's very easy to look at the things which are not fixed, the things which are wrong in life. What are the odds that we can correct all of those things? So we need to be mindful where we focus our attention. And if we focus our attention on things which are intact, and be grateful, take a moment and be thankful, and not only just noting that it was a good day, someone helped me, but also think, take a little step deeper and write that thing, and then write a reflection. Why a positive thing happened? Because research shows just noticing positive things is not enough, but attributing to the source. Why you got a phone call from your aunt, why you got, when you were exiting the subway station, someone held a door for you, why you saw someone doing a positive thing and you felt uplifted. That attribution digs into the brain and into our thinking channels, and that builds the long-term resources.
Okay, wonderful. There's so much more we can say, and for that we're going to have to come back for another segment to get more insights into strength-based resilience. So thank you very much, Dr. Rashid.
Thank you.
Hey YouTube, we hope you benefited from this video. If you liked it, or if you didn't, let us know in the comments below. And if you're interested in learning more, check out some of our other videos. And don't forget to subscribe so you can get new videos every Monday, Wednesday, and Friday.